Testing cranial nerve 1, the olfactory nerve. We'll test this nerve in 3 steps. The first will be to ask the patient about sense of smell. The second will be to inspect the nostrils for an occlusion. And the third will be to test the actual nerve. How long have you noticed a change in your ability to smell?
1 week.
Then we'll inspect. Can you look up at the ceiling, please? Okay, and then can you occlude one nostril? Close your eyes, please. And can you smell the milder of my 2 scents? Can you identify that?
Mint.
Can you occlude your left nostril? Can you identify this?
Clove.
The optic nerve. To test the optic nerve, we're going to first inspect the external and the internal structures of the eye. We're going to test visual acuity. We'll test the visual fields with the confrontation test, and we'll do our 3 pupillary reflexes. First, inspection of the external structures of the eye. We'll have a list in special senses of all of the things to note and look for on the surface of the eye and the pupil. Additionally, in special senses class, we'll go over the fundoscopic exam with an ophthalmoscope. Can you look straight ahead? And inspect the back of the eye, first looking at the optic disc, then at the vessels, then the general background, and then the macula. We'll test visual acuity and color vision using a card with shapes, colors, and a sentence written on the back. Can you read that sentence?
The early bird gets the worm.
Can you tell me which shape this is?
Triangle.
And what color is it?
Green.
Can you tell me what shape this is?
Circle.
And what color is it?
Yellow.
We'll test his field of vision with the confrontation test. We accomplish this by bringing a finger or an object in to his field of vision from 8 different directions. Can you cover your right eye, please? And look straight ahead at the wall right there, or at me. Can you see my finger now?
No.
Can you tell me when you see it?
I see it.
Is it moving or still?
It's still.
Tell me when you can see my finger.
I see it.
Is it moving or still?
It's moving.
Tell me when you can see my finger. Is it moving?
I see it, and it's still.
Tell me when you can see my finger.
I see it.
Is it moving or still?
Still.
Tell me when you see it.
I see it.
Is it moving or still?
It is moving.
Tell me when you see my finger.
I see it.
Is it moving or still?
Still.
Tell me when you see my finger.
I see it.
Is it moving or still?
Moving.
And tell me when you see my finger.
I see it.
Is it moving or still?
It's still.
And then we test the other eye and compare fields of vision. Our 3 reflexes are the direct light response, the indirect light response, and the accommodation response. These are pupillary responses in which the pupil is expected to constrict. Can you hold your hand up like this? The direct light response, I shine a light in an eye and observe pupillary constriction. Cranial nerve 2 is sensory for this reflex, cranial nerve 3 is the motor, and the integrating center is in the midbrain. The indirect light response, I'm going to shine a light in the right eye and note left pupillary constriction. And in the left eye, and note constriction of the right pupil. Once again, we're using cranial nerve 2 as our sensory on this. Cranial nerve 3 is the motor, and the integrating center is in the midbrain. You can put your hand down. And our last response for cranial nerve 2 is the accommodation response. Can you look at my finger and can you follow it in? What we should note is convergence of the eyes and constriction of the pupil. Cranial nerve 2 is sensory for this response, cranial nerve 3 is motor, and the reflex is integrated in the occipital cortex. Cranial nerves 3, 4, and 6, the oculomotor, the trochlear, and the abducens nerve, are tested as one unit, as all three of them are responsible for movement of the eye. The first tests focus on cranial nerve 3 alone. First thing I'm going to do is look at his eyes, looking for a droopy eyelid called ptosis. Second thing is I will reproduce the reflexes we did with cranial nerve 2. Our three reflexes are the direct light response, the indirect light response, and the accommodation response. These are pupillary responses in which the pupil is expected to constrict. Can you hold your hand up like this? The direct light response, I shine a light in an eye and observe pupillary constriction. Cranial nerve 2 is sensory for this reflex, cranial nerve 3 is the motor, and the integrating center is in the midbrain. The indirect light response, I'm going to shine a light in the right eye and note left pupillary constriction. And in the left eye, and note constriction of the right pupil. Once again, we're using cranial nerve 2 as our sensory on this. Cranial nerve 3 is the motor, and the integrating center is in the midbrain. You can put your hand down. And our last response for cranial nerve 2 is the accommodation response. Can you look at my finger and can you follow it in? What we should note is convergence of the eyes and constriction of the pupil. Cranial nerve 2 is sensory for this response, cranial nerve 3 is motor, and the reflex is integrated in the occipital cortex. And finally, we'll test the cardinal fields of gaze by asking the patient to follow the doctor's finger through space while maintaining his head position or keeping his head still. Can you follow my finger here? Okay, and relax. We use the H pattern because it incorporates movement of all 6 muscles. We want to make sure we state during an exam that downward and medial movement of the eye is accomplished by the superior oblique muscle innervated by the trochlear nerve, and lateral movement of the eye is accomplished by the lateral rectus innervated by the abducens nerve. The trigeminal nerve. Trigeminal nerve is in 3 parts, the ophthalmic, the maxillary, and the mandibular. It's easy to remember the procedures for the trigeminal nerve because the ophthalmic division, ophthalmic is eye, we're going to do 2 procedures to the patient's eyes. Maxillary comes across the center of the face, we're going to do 2 procedures on the patient's face, and mandibular along the jaw, we're going to do 2 procedures at the patient's mouth. The first exam procedure will be the oculocardiac reflex. We'll establish the patient's radial pulse. Can you close your eyes, please? I'm just going to rest my finger on your eye like this. And the pulse rate will begin to decrease. Cranial nerve 5 is sensory on this reflex. Cranial nerve 10 is motor, and the integrating center is in the medulla. The other reflex for the eye will be the corneal reflex. Can you look over that direction? Lightly with a sterile cotton wisp, touch the edge of the cornea, and the patient will blink and tear. Cranial nerve 5 is sensory for this response. Cranial nerve 7 is motor. The integrating center is in the pons. 2 procedures we use on the patient's face are the same families we did with the somatosensory exam, using light touch and sharp and dull. analogous to spinothalamic tract and dorsal columns. In this case, light touch would be the trigeminal lemniscus. Crude touch and sharp will be the trigeminothalamic tract. I've got a brush here that's going to feel light and wispy. Can you close your eyes and tell me when you feel the brush on your face?
Feel it.
Keep telling me.
Feel it. Feel it. Feel it. Feel it. I feel it. 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 Feel it.
Using 3 spots per division, we get full coverage of the entire face. The other procedure we'll do on the face is sharp versus dull discrimination. I've got a neurological pin that feels sharp and dull. Can you close your eyes and tell me if you feel sharp or dull?
Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. 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 Dull. 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 Sharp.
The 2 procedures we'll do for the patient's mouth are palpation of the muscles of mastication. Can you clench your teeth really tight? Palpating the masseter muscle and the temporalis muscle. And we'll do light touch inside the mouth. We want to touch behind the teeth, hard palate, inside the cheeks and both sides of the tongue. Can you open your mouth and close your eyes and tell me when you feel?
Yeah. Yeah.
Cranial nerve 7. Cranial nerve 7 is responsible for 2 functions we're going to test today. The first will be taste on the anterior 2/3 of the tongue, where the patient's going to experience sweet, salty, and sour sensations, and motor to the muscles of facial expression. Can you tell me how long you've been experiencing difficulty tasting sweet, salty, and sour things on the front 2/3 of your tongue?
1 week.
To test motor function, I'll observe the patient's face at rest. Can you raise your eyebrows up as high as they'll go? Can you close your eyes as tightly as you can? Can you smile? Can you frown? Can you puff out your cheeks? And can you show me all your teeth at once? Okay, thank you. We look for symmetry during all of those motions. Cranial nerve 8 is the cochleovestibular nerve. It's responsible for hearing and for equilibrium. The first step we're going to do is to test the cochlear nerve. To do that, we're going to do 2 screening tests to determine which ear may be the affected ear. The first is called the finger rub test. Can you cover your right ear, please? Can you hear my fingers? And can you tell me when they stop?
They stopped.
Can you cover the other ear, please? Can you hear my fingers here?
Yes.
And can you tell me when they stop?
They stopped.
Okay. The second test is the whisper test. Can you cover your right ear, please? Can you close your eyes? And answer the question that I'm going to ask you. What's today?
Tuesday.
Can you cover the other ear, please? What's your first name?
Matthew.
To determine the nature of the hearing loss, we'll use a 512 tuning fork and Weber's test and Ryan's test. For Weber's test, we'll strike the tuning fork, put it on top of the patient's head. Can you hear that vibrating in your head?
Yes.
Can you hear it more in one ear, or is it equal?
It's equal in both.
Normal finding would be the patient would be able to hear the tuning fork equally in both ears. If the patient's hearing loss were due to a conductive hearing loss or a blockage in the external auditory canal, damage to the eardrum or to the ossicles, the patient would hear the tuning fork better in his bad ear. If the patient's hearing loss were due to a nerve damage or cochlear damage, the patient would hear the tuning fork better in his good ear. Second test is Rhine's test. Can you hear the tuning fork vibrating in your head?
Yes.
Can you tell me when it stops?
Stop.
I'll move it to the front of his ear. Can you tell me when it stops here?
Stop.
Our normal finding for Rhine's will be the patient should hear twice as long in the air as he does with the tuning fork against the mastoid process. If the patient has difficulty hearing the tuning fork against the mastoid process and in the air, if both of those are decreased or absent, the patient will have a nerve or sensory neural hearing loss. If the patient has a blockage, tympanic membrane damage, or ossicle damage, the patient will hear it fine on the mastoid process, but conduction through the air will be decreased. That's our conductive deafness. The vestibular portion of cranial nerve 8 is for balance. We'll start with the Fukuda step test. Can you stand up, please? Can you close your eyes? And can you march in place for 50 steps? That's fine, you can stop and you can have a seat. What we'll notice on the Fukuda step test is the patient will begin to turn toward the side of a vestibular nerve lesion due to an imbalance in vestibular inputs. The next exam procedure is the vestibulo-ocular reflex. Can you look straight? Can you look straight at me and relax your head? And as I turn the patient's head, his eyes should stay focused on me. We can do this slow and then a little faster. Then we'll test the whirling chair test. Can you look straight ahead and relax your eyes? Lift your feet up a little bit. Just relax. Relax your eyes. Don't look at anything. So, just relax and the rhythmic oscillation of his eyes is called octokinetic nystagmus. It's a response to a sustained head movement. The fast component should be in the direction that the chair is moving. The last procedure for the vestibulocochlear nerve is the Hall-Pike-Dix maneuver. We're going to have the patient turn his head 45 degrees, and can you just relax your eyes and tilt the patient back quickly. We're going to note any nystagmus. Sit up. Do the other side. Just relax your eyes. Sit up. Presence of nystagmus after 2 to 5 seconds, which then fatigues in about 30 seconds, would indicate a condition called benign paroxysmal positional vertigo. Cranial nerves 9 and 10 are tested together as a unit, as their functions overlap so much. First thing we're going to do is ask the patient, how long have you been noticing hoarseness in your voice?
1 week.
How long have you been noticing difficulty tasting bitter things in the back part of your tongue and throat?
1 week.
We'll ask the patient to swallow while palpating the thyroid cartilage. Can you swallow, please? noting smoothness and symmetry. I'll also check the uvular reflex, shining a light in the back of the patient's mouth. Can you open your mouth and stick out your tongue? And can you say ah?
Ah.
We're looking for symmetrical elevation of the uvula. Cranial nerve 9 is sensory on the uvula, cranial nerve 10 is motor, and the integrating center for that reflex or that response is the medulla. We'll also test the carotid sinus reflex by establishing the patient's radial pulse. Can you turn your head and look there? Press in the carotid sinus area. Pulse rate begins to decrease. Cranial nerve 9 is sensory for this response. Cranial nerve 10 is motor, and the integrating center is in the medulla. The last procedure for cranial nerves 9 and 10 is the gag reflex, which we only describe in our testing here. We'll take a tongue depressor, ask the patient to open his mouth as wide as possible. Can you open your mouth? I would take a tongue depressor and touch the back of his throat. You can close your mouth. The sensation of the tongue depressor on the back of the throat excites cranial nerve 9. Cranial nerve 10 will excite the motor fibers in the back of the throat to expel the tongue depressor. So our sensory nerve for the gag reflex is cranial nerve 9, the motor nerve is cranial nerve 10, and the integrating center is in the medulla. Cranial nerve 11 innervates the trapezius muscle and the sternomastoid muscle. Our first step in evaluation will be to inspect the tone and symmetry through the trapezius muscle. We'll then palpate the trapezius muscle, and just relax there. And then finally muscle test the trapezius muscle. Can you shrug your shoulders up, please? And can you hold against resistance? The other component to cranial nerve 11 testing is testing the sternomastoid muscle. We'll begin with inspection. Then we'll palpate the sternomastoid muscle throughout different heads of the muscle. Then we'll muscle test the muscle. Can you hold your head in this position while I push? Can you turn your head and look over this shoulder? Can you hold your head in this position? I'm trying to bring his head back to neutral. Cranial nerve 12 is the hypoglossal nerve. It innervates the tongue. We'll begin our examination by inspection of the tongue. Can you stick out your tongue, please? We look for atrophy, fasciculations, muscle twitching, or any deviation which would indicate weakness. Second, we'll muscle test the hypoglossal nerve. Can you stick your tongue inside your cheek and hold it there, please? Can you stick your tongue in the other cheek and hold it there?